So we'll go ahead and get started. My name is Sara Curtis, she, her pronouns. I'm the Advocacy and Communication Specialist at the Worker Justice Center of New York. And Emma, would you like to introduce yourself?
Sure. My name is Emma Kryche. I am the Director of Advocacy, Outreach, and Education, also at the Worker Justice Center of New York. Welcome, everyone. We are so happy to have you here with us this evening.
Thank you, Emma. Yeah, thank you all very much for joining us. I took a little bit of work to throw this panel together, and we just have an amazing suite of guest speakers, colleagues, partners from across the state, representing numerous organizations, and we're just very grateful to, even though virtually, to be joining with all of you. Okay, Emma, you want to kick it off?
Yeah, I guess before we get started, I do want to just invite people to introduce themselves in the chat. If you you may find that there are folks here that you know or that you've heard about, that you're acquainted with. So I want to encourage you all to use the chat function to communicate with each other and introduce yourselves, and maybe share a little bit about your connection to the organization, whether you're a staff member, a board member, a donor, a community member, a partner. We'd love to get you all connected and communicating with each other. Great. So are we all set on interpretation? For those who just joined, I'm going to make one last reminder to you all to please go ahead and select your preferred language at the, usually it shows up at the bottom or the top of your screen in your menu bar, a small globe where you can select either English or Spanish. Para quienes acaban de entrar, si quiere interpretación del inglés al español, pueden escoger el globito en su pantalla donde dice español o el inglés para seleccionar su idioma preferido. Great. Okay, so we're going to dive right in. I wanted to just start off our panel today by laying a little bit of context for the conversation and for reflecting back on the past year of our work together. Sorry, here, I'm working on getting the tech set up here. So over the course of our time together, we're going to just start off by talking a little bit about what this past year has looked like, what some of the context is for the work that we've been doing in our advocacy arena. And then we're going to reflect on the two major campaigns that our organization worked on over the course of 2021. And then we're going to be looking forward to some of the issues that we know are going to be really critical for our communities moving forward into 2022. And we hope to have a little bit of time after our presenters speak for some back and forth to respond to Q&A and reflections amongst all the participants. So that's kind of how we're going to move this forward. Again, we want to acknowledge and thank our panelists who are joining us from the New York Civil Liberties Union, from New York Immigration Coalition, from the One Fair Wage campaign, and from the Campaign for New York Health. We're so excited to have you here. So I want to just start again by saying a few words about what 2021 has been like for us. As an organization, so much of the work that we've been doing this year has been shaped by the immediate crisis of ongoing pandemic response work. So, of course, we're well into this pandemic, over a year and a half since the shutdown began, and yet we continue to be shaped by it in so many ways, and in the ways that we are called to do the work that we do in our communities. What we've seen over the course of this past year and a half is that the folks that we serve are facing kind of one of two scenarios. On the one hand, we have people who have remained employed throughout the pandemic, often in essential industries, and who have faced a very high risk of exposure to COVID-19 due to inadequate workplace health and safety protections, for example, in industries like food processing and agriculture. And then on the other hand, we have a group of people who have been impacted by the economic shutdown, which of course, we've seen some we haven't remained totally shut down, but there are so many ways in which the economic fallout from last year's shutdown continues to reverberate. And those are people who, for some period of time, couldn't work, didn't have the choice to work, and struggled to put food on the table because they had no social safety net that they could rely upon. And this happened, we saw it repeatedly among workers in the service industry, workers who worked as domestic workers, for example, that were unemployed during that period of time and have struggled to get back on their feet. So as an organization, we were really faced with this challenge of how can we be responsive to the immediate material and health related needs of our communities while recognizing that there was an opportunity for some real structural change to happen, and looking at how do we seize on those opportunities to affect real systemic change in the midst of this crisis, when people were really beginning to look at all of the contradictions and problems within our economic system, right? And in the midst of all that, we were trying to pivot to do responsive programming with our direct service work, while we were looking at the ways that the pandemic really laid bare these systemic inequalities and the fundamental contradictions, right? We have this enormous segment of our community, of our workforce, that we are, on the one hand, understanding to be essential, right? And on the other hand, being treated by all of our systems as disposable. And we've seen at the federal level, there are these efforts to advance immigration reform proposals and create a pathway citizenship for essential workers that have come up against really significant political barriers. But here in New York, we have fortunately had the opportunity to propose some bold solutions and really push New York's political leaders to make good on our state's progressive promise when it comes to protecting workers and to supporting immigrants who contribute so much to the social and economic fabric of our communities. These opportunities, of course, all emerged in midst of shifting political, really shifting political landscape over the past year at the state level in particular. So as you will see in the coming minutes, as we discuss further the campaigns that we've been working on, how our policy fights have been shaped by, on the one hand, the new Democratic supermajority in the state legislature, then the, of course, very dramatic downfall of Governor Cuomo, first his weakening position and then his eventual resignation in the midst of scandal. And now what we're seeing is a new governor, Governor Hochul's efforts to try to win trust of immigrant New Yorkers in really attempting to make up for what is really a less than progressive track record on immigrant issues historically. So this is all kind of in the mix as we're looking at the campaigns that we're working to promote moving forward in 2022. So I will wrap it up there and turn it over to Sara to say a few words about one of the campaigns that we worked on, which was the New York Hero campaign. Sara?
New York, what? I didn't hear.
I don't know. New York Hero campaign.
New York Hero campaign, yes. Thank you so much. Just a reminder that we do, for those who joined, we do have an interpretation available in English and Spanish. If you look at the bottom of your screen, you'll see a little globe interpretation bundle, and you can either select English or Spanish. And for anybody who's speaking today, I'd just like to remind that we'll be moving a little bit slower in our style of speaking, just so we make sure that the interpreters can keep good pace. So the New York Hero campaign, we at Worker Justice Center, and this is a little anecdote, I remember when COVID first started hitting the news, when we all first started seeing it in the news. And I remember Emma was visiting the Rochester office that day, and we were having a conversation. Emma, I don't know if you remember this, but immediately just started thinking about the workers who are in the dairy industry, who are in the factories, who are living in employer provided housing, where there's not social distancing really allowed. Folks have overcrowded housing, and they work where they live, especially in the dairy farms. And I think a lot of people were expecting the worst out of that situation, and I think we were all very scared and nervous. And of course, early on, there was a lack of PPE equipment available amongst a lot of workplaces. Emma, if you want to switch the next slide over. We started hearing in the news of horrible cases about mass infections at factories. Amazon had 20,000 employees test positive for COVID, plant workers. It started spreading amongst the farms, and it also spread amongst whole families as well. So early on we joined with the Essential Workers Coalition in New York State, and we were made up of unions, worker centers, immigrant rights organizations, legal service providers, and health and safety organizations and community-based organizations. And what was unique for our organization is, although we work in a lot of statewide coalitions, I think this was the first time we really worked side by side with a lot of union representation. So that was interesting for us. And together we saw that working people were being denied the basic right to a safe and healthy workplace. And we moved together to build a statewide movement to protect workers on the front line during the pandemic. As Emma mentioned, that this was the group of people who were the frontline workers. They were still working. They didn't lose their jobs, and they had to work through the pandemic in really horrible working conditions without health and safety precautions in place, and without PPE equipment, without the ability to effectively quarantine if they needed to. And if you want to go to the next slide. I wanted to play this really quick. And my apologies to the interpreters. I hope the interpretation is able to not be too fast for this video. Oh, I don't think it has sound, Emma.
All right, I'm trying.
Sorry, I had to start it over.
The sound is very low for some reason, but there are subtitles.
Oh, okay, you should be able to turn it up right there.
When you share the screen, you have to turn on system sound or people
Yes.
won't hear it.
I'll try that one more time.
Sorry about that. This was a video that was put out by our coalition. I felt really grateful also working in communications that our coalitions just had really wonderful communications departments. We partnered with a lot of really amazing artists to put out popular education type materials.
All right, I'm gonna give it one more go.
Dear New York, in March, you were called upon to stop the spread of COVID-19, and together we flattened the curve. For many, this meant masking up, social distancing, and staying home. But for us, it meant showing up to work. We showed up early and stayed late. We swallowed our fear and exhaustion to make sure you were fed. We weighed the risk of bringing the virus home to our families against the risk of losing our jobs. We armed ourselves in week-old masks and makeshift PPE to take care of you, New York. As essential workers, we have been labeled heroes for protecting you. We worked without protections and risked our lives to get New York through the first wave. When a second wave comes, who will protect New York if the front line falls sick? New York, we took care of you. Now will you take care of us?
Thank you, Emma. And as we all know, the second wave of COVID did come. and the pandemic isn't over yet. And we'll discuss a little bit that political context and what it meant for the campaign. And I'll just wait for Emma to go back to the slide we should be on.
I am having all the technical difficulties today. I'm sorry. This
You're
is
good.
a hot mess. Thanks for bearing with us. There we go. We're back.
Yes. Okay, so we did it. The amazing news is we were, after a year-long fight, the coalition was able to celebrate this monumental victory with the signing of the New York HERO Act into law, enshrining a worker-led vision of health and safety for our communities. And what did we win? Well, first, I just want to say it was signed into law in May of 2021. But it wasn't until September 6th, when Governor Hochul had come into office, that she declared COVID-19 a threat to public health and put the New York HERO Act into effect. So that means that even though we had this this new law that was to protect workers and health and safety in the workplace, because Governor Cuomo had removed COVID as a public health emergency, because because Governor Cuomo had no longer, by that point in May, had designated COVID a health and safety emergency, then we still had the law, but it wasn't, there weren't enforceable standards. So thankfully, with some advocacy pressure and political pressure, Governor Kathy Hochul enshrined it into law with enforceable mandates. So again, these are enforceable standards. They're not just guidelines, and is the first in the nation permanent airborne infectious disease standard that will protect and empower workers from this pandemic and whatever may come next. And to speak to Emma's point about how do we take this moment of crisis and use it, Emma, if you could go backside. How do we take this moment of crisis and, while dealing with it, also try to create systematic change out of it? We now have this enforceable standard for any additional airborne disease, any new variant of COVID, or anything else that might happen in the future. A big component of this act is that workers now have a stronger voice in the workplace. And ensures that workers, communities, and businesses are protected by providing protocols on testing, face masks, PPE, social distancing, hand hygiene, disinfection, and engineering controls. One thing that's not listed here is something really incredible that came out of this is we were able to advocate for the creation of workplace health and safety committees. So what that means is workers are now legally allowed to create, and they're allowed and encouraged and protected to create committees in their workplaces to have a say in the health and safety of where they work. And they're also now protected from any retaliation by their employer for speaking up and demanding better conditions. And in doing so, it's holding dangerous workplaces accountable. There's very strong penalties and enforcement mechanisms that will hopefully lead to increased compliance and lower the transmission rates of COVID, and which in turn, will boost workplace safety. Okay, so I just want to, you can go ahead, Emma. Thank you. So we have here we're putting out new Know Your Rights materials, our outreach and education team, many other partners in the coalition are starting to spread the word. And we're still very much in the early stages of implementation. Both workers and employers alike are learning about the new mandate and what it means for them in terms of their responsibility and their rights. Some challenges ahead include employer compliance. So employers must now adopt these health and safety plans, and it's they can either choose the ones that are provided by the New York Department of Labor or establish an alternative plan that meets or exceeds the state's minimum requirements. And they're also supposed to provide a copy of that exposure prevention plan and promote it in the workplace. But as we know, word is just getting out about this new standard, this new mandate, and things are moving a little slow in terms of implementation. And that also includes amongst workers. So a lot of outreach and education is going to be needed to workplaces, worker provided housing, so that folks know about their rights, and so that they also understand the process of forming a health and safety worker committee. Now, New York State just last year, 2 years ago now, won the right for farm workers to organize. We just had the first farm worker union established in New York State. It's a very exciting time. And a lot of people see the formation of these health and safety committees as kind of a first introductory step to workers organizing amongst themselves. And that's really promising. But we do need to do some more outreach and education so that everybody knows about this. And I think we need to move on. I have one more thing to say, but we'll pass it along to Emma now for the Excluded Worker Fund.
Great. Thanks, Sara. So I know that many of you are aware of the Excluded Worker Fund. I know that Sara has done an incredible job with our social media and our communications in elevating the work that we've been doing as part of the Excluded Worker Fund. But I just want to backtrack for those of you who are not familiar with this campaign. The Excluded Worker Fund campaign the Fund Excluded Workers campaign began last year, right after the shutdown, when it became immediately clear to so many of us that work with immigrant communities and immigrant community members that there were people really suffering economically from the shutdown who had no access to any kind of social safety net. We, as an organization, decided to join together with the other members of the Fund Excluded Workers campaign because there were 1.2 million New Yorkers that were ineligible for unemployment or federal stimulus aid. And that went on for hundreds and hundreds of days, all throughout the year 2000, since from the beginning of the shutdown up until when we ultimately prevailed in getting this fund established through the state budget in the spring of this year. We as an organization knew that despite our efforts to provide emergency cash assistance, that we would be far more effective at addressing the need that we saw in the communities that we serve by coming together with other members of the coalition to fight for a state-funded program than we would be able to in providing piecemeal individual support to families that were economically impacted by the pandemic. So we really knew that no matter how hard we worked, no matter how hard our partners worked, there was no way that we could piece together the kind of response that we needed just from mutual aid and nonprofit organizations. This campaign went on throughout pretty much all of last year and well into this year. And as I will talk about shortly, will be rebooted, is in the process of getting rebooted. We held virtual press conferences. There were rallies, there were caravans, there was a hunger strike led by impacted workers from different parts of New York State. This was an extremely groundbreaking campaign. We were the first to demand any kind of fund of this scale. Our demand was $3.5 billion for excluded workers, which just, was unprecedented. But it was truly a remarkable campaign driven by the urgency of the need and of the realization among so many that they were being talked about as if they were essential and again treated as if they were disposable. Ultimately, we did prevail. We won $2.1 billion in the creation of the Excluded Workers Fund. It was the first of its kind in the country. It still is the only of its kind. And what this consisted of is retroactive relief payments to people who lost at least 50% of their income at some point during the first year of the pandemic, provided that they earn under or no more than $26,208 between April of last year and April of this year. So the maximum benefit award amount for the Excluded Workers Fund is $15,600 pre-taxes. That's tier 1 benefit. And then there was a second benefit level that was established in the legislation at $3,200. So we're not talking, you know, a few $100s. We're talking about real money that is going to put food on the table, help people catch up on their bills, on their back rent, and really take care of other essential needs. I am going to actually take a moment to introduce you to one of the individuals that we were able to assist in applying for the Excluded Worker Fund. So the fund, although it was established in the spring of this year through the budget process, the launch did not occur until August 1st. So the fund opened for applications on August 1st. We were one of many organizations across the state that throughout the summer was gearing up to educate community members about the existence of this fund. But what we found is that by the beginning of August, there were still a lot of people who were impacted by the pandemic economically, whether they themselves lost income or whether they lost a family member or a breadwinner who was incapacitated. There were still a lot of education and outreach that needed to happen to let people know about the benefits, about the criteria to apply, about the required documentation. We were fortunate enough to be able to bring on a really phenomenal team of advocates to assist with the application process. And they have been working their tails off for the past 2.5 months, the past 2 months in helping to submit these applications. And I'd like to take a moment to introduce you to Paulina, who's going to share a little bit about her experience applying for the Excluded Worker Fund and what it has meant to her. Paulina, creo que está en la línea, ¿verdad?
Sí, aquí estoy.
Ok, permítame. Adelante.
Hola, buenas tardes.
Buenas tardes. Puede seguir. And I'll just remind everyone, if you do not speak Spanish, you can select the English interpretation button on your screen. Paulina, es que hay interpretación para quienes no hablan español. So puede hablar en español y quienes necesiten interpretación lo van a recibir.
Ok. Sí, buenas tardes. Mi nombre es Paulina Reyes. Y yo estoy dando la como de cómo me siento de que yo fui afectada por la pandemia, pero gracias al programa que se pudo hacer para los trabajadores excluidos, yo recibí la tarjeta y pues solo decirles que estoy totalmente agradecida primero con Dios y después con este programa que se pudo hacer realidad, porque yo de verdad que tenía un estrés horrible porque yo decía, ¿cómo le vamos a hacer? Yo perdí mi trabajo por completo, pero pues gracias a esta ayuda que dieron, pues creo que me siento un poco mejor, mucho mejor de lo que estaba.
¿Nos puede contar un poquito, Paulina, en qué tipo de gastos está con esta tarjeta? ¿Qué tipo de cosas puede hacer ahora que no pudo hacer antes?
Claro que sí. Yo con esa tarjeta he podido estar pagando mis biles, por ejemplo, la luz, la comida, la renta, porque de verdad que eso me tenía estresada porque pues no tenía de dónde sacar un ingreso porque como le platico, perdí mi empleo por completo. Entonces esta tarjeta pues fue una gran ayuda para mí porque gracias a eso he estado pudiendo pagar mi renta, mis biles, mi comida.
¿Y qué tipo de trabajo hacía usted antes? Sin decir dónde, pero...
Yo trabajaba en una empacadora de productos donde pues realmente se cerró, no hubo más trabajo y entonces tuvimos que salir de ahí.
¿De comida o de otros productos?
No, de otros productos.
Gracias, Paulina, por compartir su historia y ojalá que si después, si puede quedarse en la línea, si haya preguntas o comentarios, puede participar también en la conversación.
Ok, gracias a ustedes.
So Paulina was one among many individuals that we were able to help through the Excluded Worker Fund program. However, as you may have heard, if you've been again following our work on social media or those of our partner organizations, there have been some recent updates, and I want to just talk for a minute about what's been going on over the past month and look at where these funds have gone. But first, I want to say that the big news is that the fund actually is nearing exhaustion, and as of last Friday evening, the Department of Labor actually closed the application. So what's happened is that even though we had $2.1 billion allocated to this fund, because so many people have been able to successfully apply, which is great news, and because so many people have successfully qualified for the Tier 1 benefit, the maximum benefit amount, we have seen that the funds have gotten distributed far more quickly than anyone anticipated. So what this means, it's both good and there's also a negative side to it. On the one hand, we're very happy to see that the money has gone out to communities and individuals like Paulina who really needed it and deserved it after contributing to their communities economically and otherwise for so many years. So we're happy to see that the funds got where they were we intended them to go, but at the same time, we know that there are many, many, many people, especially in rural communities and especially outside of New York City, that don't even know about the fund yet, or that haven't yet had the opportunity to apply for the fund that would otherwise qualify. At this point in time, you can see the Department of Labor has received far more claims than they will be able to approve, as they have already dispersed more than half of the funds that have been allocated. So we are very concerned about those individuals, both those who have not yet had the opportunity to apply and those who have applied but will not get funds because the benefits will be gone by the time their applications are processed. We're also really concerned about geographic equity and ensuring that our upstate communities and our rural communities in particular are getting their fair share. Unfortunately, what we're seeing is it's not just that more people in urban areas, and particularly New York City, are getting access to this fund, but that proportionate to the population, upstate has lagged behind New York City in terms of application as far as a percentage of the population. So we are concerned that our upstate communities are being left behind. I will just use this moment to tee up the fact that we are going to be going back to Albany in the coming year, and we've already started to do some advocacy around replenishing the Excluded Workers Fund. We did a press conference last week, which is up on our Facebook page and has been shared on our social media. We got some really good coverage together with our partners of the fact the fund is closing with so many people excluded, and we are going to be going back to Albany to ask for more funds and to really also start to think more transformationally about what would it mean to create a solution, a permanent solution to the exclusion of so many immigrant workers from our unemployment system. So stay tuned for more on that. What we do know is that the success of this campaign last year was, I can't overstate what an unprecedented and enormous victory it truly was. And we were able to achieve that because we built a robust statewide coalition that engaged people in different regions of the state, that highlighted the contributions of excluded workers in different industries across the state. And if we are going to be successful in round two, then we know that we will need to continue to build that robust statewide coalition. And I want to invite all of you to join in those efforts. And I'm more than happy to talk with some of you offline if you are interested in knowing how you can get involved. I know we're running a bit behind on time, so I'm going to move this along to our panelists. Again, we're so happy you could join us. We don't want to cut too much into your time, so I will sign off and turn this back over to Sara to introduce our panelists.
Thank you so much, Emma. So we're going to move now into what are the issues that matter for our community in 2022? What are going to be our organization's legislative priorities for 2022? And we're so excited to have all these amazing partners on the call. And we will be moving one by one. And I encourage the guest speakers to introduce yourself with pronouns, your organization, the campaign that we're working on. And if you have a PowerPoint to share, I'll move through that as well. So I believe first up, we have Inayat.
Hello.
Hi.
I assumed I was going third for some reason. Thank you, WJCNY, for this opportunity, and congratulations on all the excellent work you've done so far. It's quite inspiring, and thank you also for bringing us all together, right? Because we get so focused on our issues, so it's really nice to hear about the success and achievements in other spaces. My name is Inayat. I'm the National Coalition Manager of One Fair Wage. We're a national organization that represents tipped workers, primarily restaurant and service sector workers who work in the food industry. But we're also a coalition organization that represents other sub-minimum wage workers, which includes incarcerated workers, workers with disabilities, and gig workers, who've all been carved out of the federal minimum wage law. I was thinking about what to share today, and I think one thing that's always very striking is sort of giving the history. So I want to talk a little bit about that before coming to the past year and COVID and what we have planned for next year. So just to let you know, the sub-minimum wage is a sort of exception to the minimum wage. Currently, the federal minimum wage is $7.25, but the sub-minimum wage is $2.13, which is a direct legacy of slavery. In New York, the minimum wage is $15 per hour, but the sub-minimum wage is still $8.35. So the idea is that you make the rest up with your tips. I have a presentation. Sara, if you could pull that up, or should I share screen?
If you want to share it, that'd be great.
Okay.
Do you have a screen share?
Okay, let me talk through first and then I will share screen. So this is just to like level set on what we're actually talking about here. So even when we say 5 for 15, there are several people who are left out of the 15. In the service industry, because it's customer facing, unfortunately, there's also a lot of bias in how people get paid, especially if you're dependent on tips to make a living. And we have a horrible $8 wage gap between front of the house tip workers in New York who are white men versus Black women. And this is more than double the national average. The demographics of the workforce of people who work in this industry are overwhelmingly women, more than 62%, and overwhelmingly people of color. And even though this is the broad demographics, as you can imagine, the leadership positions does not reflect this. When I say that this was a legacy of slavery, post-emancipation, people actually had to pay to have the privilege of working for a $0 wage to be able to earn tips as a wage to survive. There's this entire history that's been documented with the Pullman porters in Chicago, and I'm going to show you an image on that very quickly. So from $0, we've moved to $2.13, which is what it's been stuck at for the last several decades. And our single policy agenda is to get rid of the sub-minimum wage. No exceptions, have everybody earn a minimum, which is obviously 15. Pre-pandemic, and then I'll come to the pandemic. Pre-pandemic, the restaurant industry was the largest and fastest growing, but also the lowest paying, the highest rates of poverty, and by far the highest rates of sexual harassment. So Professor Catherine McKinnon, who's this incredible scholar at the Harvard Law School and has studied this issue pretty much her whole career, says that it's the way sexual harassment is concentrated in the restaurant industry is more than she's seen in any other industry she studied, including the military. So after the pandemic, everything got worse. Everything that's bad about our industry just got accentuated. So 1 in 4 people who lost their jobs were in the restaurant industry. And a large majority of them had difficulty accessing this unemployment insurance. And completely appreciate the work you shared. And we do acknowledge that undocumented workers do form up a large part of our workforce here in New York. In our industry, it wasn't just people being undocumented who were unable to access, it was also just simply earning too less. So it was just having such low of a base figure that you were not eligible to get your unemployment insurance. And so when the government was telling people that you earn too little to be paid unemployment insurance, people were like, maybe I earn too little. And so what we began to see was people actually leaving this industry. In about February of this year, before the summer, when we surveyed our workers, we found that this was like when restaurants were just about reopening, there were mask mandates. We found that people who did have to go back to work were actually having it really hard because they were doubling up as public health marshals and enforcing rules, enforcing mask rules, enforcing distance rules, which affected their tips, which affected their livelihood, right? So they were being asked to do more for less. 75% of Black New York restaurant workers reported that their tips had declined by 50% or more. And there's a huge gender angle to this because women in New York were far more likely to report that their tips had decreased because they enforced public health rules higher than men. So this was when we checked in with people in about February. And over the summer, of course, we had like massive reopening. New York was back, restaurants had officially reopened and so on. But you must have followed that there was like a huge shortage of actually being able to hire workers, right? And what we said was that it's not a worker shortage, it's a wage shortage. If people are paid and compensated, not just for their labor, but for all these other things that they're being asked to do, then maybe they will actually come back to work. And we did this survey in around May, and we found that over half of the workforce said that they were considering leaving. And the single highest reason that they would stay is a full wage with tips on top, more than even paid sick leave or any kind of accommodations for COVID, because people know that having a full wage is like a much longer term thing, more than just, you know, what we're living through right now. So that's sort of the background I wanted to offer you. In terms of specific legislation and policy moving in New York, in December of 2019, the then Governor Cuomo issued an executive action which removed exactly what we've been fighting for some tipped workers, so nail salon workers, car wash workers. So it was the coalition that was asking for one fair wage, but basically some people got it and not everybody. And what we are sort of focused on now going into this next year is saying, okay, you've proved that you can remove sub-minimum wage for certain constituencies. Why aren't you doing it for everybody else? The people that are covered in the 2019 executive action are about like 70,000 workers across the state. There's more than 200,000 restaurant workers across the state, right? So we're saying, great, that's a great precedent, but include us in that executive action, which will actually cover more than 3 times the number of people and the number of workers who have been covered. So that's really like our focus for the next year. We're focusing on the governor, we're focusing on executive action, but we also have bills moving in the state legislature. So whichever comes first is fine with us. Now I'm going to quickly share screen and show you some of what we've been up to.
We're not seeing your slides. You might need to reshare.
Oops.
You're fine.
You're good? Do you see it full screen?
We see your screen, yes, but not your slides.
Yikes.
Seeing your Google Doc.
Thank you for bearing with me. Now?
Nope.
I see it.
You
Says-
do.
It
You-
says flow for New York on the top, right?
Oh no, that's not the
That's not what you're
document.
looking for.
There should be a PPT. No?
No.
Okay, just give me 1 second. Now?
Yep.
Okay, great. So yeah, so these are images from 1853 from Chicago, which really is our history of tip workers. If you can imagine the perversity of actually paying to earn the privilege to earn a tip and feed your family. On the right, we can see that the National Restaurant Association, which is an industry lobby that lobbies very hard against this carve out of removing sub-minimum wages, have been being protested against since the 1960s. Though this is our history, we do feel like the last year has changed a lot, and the momentum is really in our favor because, like other people on this call, the pandemic has done a lot for like consciousness raising. And we did launch a fund which provided emergency relief to over 260,000 workers, across the country, the majority of whom are based in New York. And you can see that, just in terms of public narrative, there seems to be this understanding that, yes, we cannot pay workers to 13. President Biden, in a town hall, I think in late July, was asked by a supposed small business owner, but later on we found out that he was the owner of like a chain of restaurants. He said, "I can't get workers back, President Biden. What is your plan to support people like me?" And he said, "You need to raise your wages if you want to get people back at work." So he literally was saying our talking points, which is, it really is an idea that whose time has come. So as we keep saying, it's not a worker shortage, it's a wage shortage. We've been doing action steadily to sort of raise this issue. In May, we did civil disobedience. In July, we protested Governor Cuomo at a fundraiser. This is from August, when there was an incoming governor coming in. We were calling on her to really address this as a sexual harassment issue because that's the ticket on which she came on. In September, I don't know if you all followed this, but there was an attack on a hostess at Carmine's, I think in Upper West, by some tourists because she asked them for their vaccination proof. So we did this action as well, pay us, don't punch us. And the last image is from today, and that's my t-shirt as well, where we announced this raise the wage voter block across the country, basically saying that here's a block of people who are only going to vote for those electeds who vote yes on raising the minimum wage and removing sub-minimum wages. So yeah, I'm gonna stop here. I think that's like the broad overview of who we are and what we've done so far. And yeah, really appreciate the space you've created to have this discussion.
Thank you so much, Inayat. And I put in the chat the website where you can learn more, One Fair Wage. .site. We'll also be sharing out these campaigns on our social media and tagging One Fair Wage to New York. And soon you'll be hearing kind of what are some action items to plug into the campaign. I'd like to introduce our next speaker, Ursula from the New York Campaign for New York Health. And Ursula, I believe you wanted to share your screen. Is that correct?
Yes, thank you so much. It's really great to be here with everyone, so many old and new comrades. Let me see if I can do the screen share. Can you see it? Awesome. Thank you so much. I'm Ursula Rozum. I'm one of the co-directors for the Campaign for New York Health. We are a statewide coalition of over 150 organizations that is committed to passing and implementing legislation for universal health care, the New York Health Act. I've been with the campaign since 2014, first as a super volunteer and then on staff in various capacities since 2016. My pronouns are she, her, and I am based in Syracuse. The Campaign for New York Health came together in 2014 when we began to see that the Affordable Care Act, despite expanding healthcare coverage, was still leaving a lot of people out of having access to insurance. And also we saw that more and more employers and insurance companies were pushing workers into expensive, high deductible plans. And so even people with insurance were unable to afford healthcare. Like I said, we are a statewide coalition. One of our many founding organizations is the New York State Nurses Association. So as I mentioned, we found back in 2019, we found that even New Yorkers with insurance were struggling to access healthcare. We conducted a statewide survey of New Yorkers. We spoke with 2,500 people. And 50% of the people with insurance were telling us that they skipped at least one type of care because of cost. And 1 out of 3 of those people were developing worsening conditions. In that process, we were able to engage several dozen organizations and really build the coalition. And we've gotten to a place where now the New York Health Act, the bill for universal single-payer healthcare, has majority support in the state legislature. So I'm going to talk a little bit about what is the New York Health Act, what it would do, how it would work. So the New York Health Act would establish a statewide fund that covers every single resident and full-time worker in New York with comprehensive health benefits, including dental care, mental health care, long-term care and support services, reproductive health care, everything that's integral to good health. And this would be without any out-of-pocket costs when we go to the doctor. And several studies have found that the New York Health Act would reduce the cost of healthcare for 90 to 95% of us. And the biggest savings would go to those who make $75,000 or less annually. So the New York Health Act is based on these principles that you see on the screen, that everyone is included in coverage, no matter where they work, what their immigration status is, what their age is. Like I mentioned, comprehensive, that we would have all the healthcare benefits. We would no longer have a fractured system where some plans include mental health care. So many plans don't cover dental care, as if teeth aren't part of your body. So the New York Health Act isn't just for universal coverage, it's really to establish the right to health care in New York State, and to establish a system that is equitable where everyone gets the health care they need, and it's based on our ability to pay. And it would establish a system that is accountable to the people of New York rather than controlled by private insurance companies. As I mentioned, it would cover the whole gamut of healthcare services, which would be more comprehensive than any plan that exists right now. A lot of people ask, this sounds great, how would you pay for it? The New York Health Plan would be funded through a few sources of funding: existing funds that come to New Yorkers for healthcare, like Medicare, Medicaid, Child Health Plus, and subsidies through the Affordable Care Act. And then rather than paying premiums to for-profit insurance companies to buy a private insurance plan, anyone who has makes an income in New York State would pay through a payroll tax that is progressive, 80% paid by the employer, and 20% paid by employee. Labor unions would be able to negotiate an even better arrangement for their members, and the first $25,000 of income would not be taxed at all. This is a graph showing where some of the savings would come from. I think the most important thing to note here is that the last large study of the New York Health Act, conducted in August of 2018, found that the bill would save at least $11 billion in the first year of implementation in overall health spending, while still covering everyone. And the biggest savings come from reducing the waste that's associated with private health plans. So this is from the RAND Corporation, which is a somewhat centrist or moderate think tank. So we feel very good about the findings of the RAND Corporation. I want to move on to where we are politically with the New York Health Act. The bill was reintroduced in March of 2021 with majority support in both the state assembly and the state senate for the first time ever. We had a majority in the assembly for several years, and we were really excited to reach that milestone in the state senate this year. However, there are challenges to passing the bill. We had a pretty heavy pressure campaign on the leadership of the legislature to bring the bill to a vote, which did not happen this year. And one of the biggest obstacles to passing the bill is a split among labor unions in support for the New York Health Act. So healthcare worker unions like the New York State Nurses Association, SEIU 1199, the Committee of Interns and Residents, unions that represent frontline healthcare workers are in strong support. Public sector unions like the New York State United Teachers, for example, are in opposition at the moment, but we're doing our best to talk with the union leadership to see what kind of amendments and adjustments in the language of the bill would bring them to the table, because we know that winning labor support is critical in a democratic state like New York to passing big pieces of legislation. A little bit about our campaign strategy. We believe that sharing our healthcare stories is one of the most powerful ways to build the movement for universal healthcare, to impact public opinion, to impact legislators. So over the years, we've done a lot of work with organizations and with our grassroots supporters on really building up the capacity of the movement to tell the story of why the current healthcare system fails New Yorkers and the changes that are needed. On the horizon, we have a few things coming up that I'm happy to share about with all of you. Just this month, we launched a new training series on healthcare storytelling. And you can see on the screen, we'll be having trainings on storytelling, bird dogging, storytelling through Twitter, storytelling through letters to the editor. I'm happy to share more information about those upcoming trainings. And I'm also really excited to share that we recently began planning a Spanish language training on the New York Health Act and healthcare storytelling with the Food Chain Workers Alliance. And so I recognize many faces in this room, so I'll be reaching out to you to share more details about this training. And if you're part of an organization and you want to get more involved in the fight, one way to start to do that is to sign up as an organizational endorser, and we'll follow up with you about ways to be involved as an organization in the coming legislative session. And we have an ongoing campaign, a story banking campaign. Well, there will be meetings with legislators coming up. And I will stop there. And thank you so much for letting me share a little bit about the campaign.
Thank you so much, Ursula. And following this webinar discussion, we'll be sending out an email in a couple of days, making sure that folks can plug into these campaigns and learn about actions that are taking place. Our next speaker, and we're trying to move along just so we have enough time for questions and answers, is Zachery Ahmed, who's policy counsel at the New York Civil Liberties Union, who's going to be talking about New York for All. And I will do a screen share, Zach, when you're ready.
Oh, thanks, I'm ready. Thank you so much, Sarah. It's really good to be here. As Sarah said, my name is Zach. I use he, him pronouns, and I want to talk to you a little bit about the New York for All campaign tonight. The New York for All campaign, in short, is a bill that would disentangle state and local authorities from immigration enforcement across New York. So if we want to go to the second slide, I'm going to go a little bit quickly here because I imagine a lot of people on this call are familiar with these issues, but the problem that this bill is intended to address is the problem of entanglement between state and local authorities and ICE. Since 2003, since ICE was created, and really before then, but particularly since the advent of ICE, the federal government has really relied on state and local authorities to scale up its immigration enforcement. Local police collaborate with ICE in a variety of ways by sharing information, by holding people sometimes who are in jail longer so that ICE can come get them, or telling ICE when exactly they're going to be released so ICE can show up to the police station and find them, or sharing personal information that they might have in their possession so that ICE can locate people and arrest them and put them into deportation proceedings. So we go to the next slide. This is something that's led to mass arrest, detention, and deportation of immigrant community members. And it's something that happens all across New York State, but particularly in upstate regions that are near the border and in places that don't have any local policies in place. There are a few places in New York, like New York City or Westchester County, and some other places here and there that have either laws or policies in place that keep ICE and local police separate. But New York State does not have any law that prevents local governments or state governments from collaborating with ICE. That's often a misconception. Sometimes people will ask me, well, isn't New York State a sanctuary state? And the short answer is no. There might be some popular conception of that, but in fact, there are no state laws that keep New York out of immigration enforcement. So if you want to go to the next slide. So this is a problem that, of course, has been fairly constant throughout, across different administrations of different political parties, but something that was ramped up under the Trump administration. Under the Trump administration, we really saw the true depths of ICE's cruelty. And the Trump administration made it a priority to expand and really lean into the cooperation with state and local authorities. That was a primary tool that administration used to do the kinds of things that it wanted to do and to carry out its immigration enforcement agenda. We are now in month, if you can go back to the last slide just for a second. We are now in month 9 of the Biden administration. And to put it diplomatically, the results have been mixed on the immigration front. I think there have been a few, good spots here and there, maybe, a little less, a bit of a reduction in immigration enforcement overall, anecdotally, but we really have not seen out of this administration a willingness to structurally reform what ICE is and how immigration enforcement works. And as such, ICE enforcement is still a major threat to immigrant communities and our communities here in New York. So, that's kind of where we are now in terms of the federal landscape. We still have to approach these issues, doing whatever we can do as New Yorkers to fight back against the deportation agenda of the federal government. Go to the next slide. So that brings us to the New York for All bill. And I'm going to go ahead and just put in the chat a little sign up form for if you want to, in case anyone wants to join our listserv and learn more about the bill and the campaign. But the bill in general is what some people might recognize as a state sanctuary bill. It's a bill that in a number of ways would prevent state and local authorities across New York, it applies to nearly every state employee and every local employee within the state, and in a variety of ways prevent them from sharing information with ICE or collaborating with ICE. Next slide. So our bill sponsors are Assemblymember Reyes, Cardenas Reyes, and Senator Julia Salazar, both from New York City. Assemblymember Reyes is from the Bronx, Senator Salazar is from Brooklyn. Go to the next slide. And to just get into a little bit of what the bill would do in particular. So as I said, it would disentangle state and local authorities, but how would it do that? So it would prohibit state and local officials from asking people about their immigration status. It would prevent them from notifying ICE about a release from jail. That's a major way that ICE finds people, is people will be taken into custody, often for a very minor offense. And then the local jail will tell ICE exactly when they could come to the jail to pick them up. This bill would prevent that. It would also prohibit the sharing of sensitive personal information with ICE by all government officials, whether that's law enforcement or any other type of government official. Go to the next slide. It very broadly restricts the use of resources for immigration enforcement. So it makes clear that local government and state government cannot use their time on duty for immigration enforcement purposes. It prohibits the use of Customs and Border Protection as interpreters, which is something that unfortunately police in the border regions sometimes do. They, if they find themselves without language services, they will sometimes call CBP and use that agency as an interpreter, and then that will lead to an enforcement action. It requires that if people are in state custody or local custody and ICE, and there's any situation in which they might have contact with ICE, which would hopefully be limited given the other parts of the bill, that they are notified of their rights and that they know that they have a right to remain silent, to not be interviewed by ICE, to have a lawyer with them. It would make sure that they know those rights. And then finally, it would give the Attorney General the power to take action if state and local authorities were violating the law. So it would set up a hotline or some other kind of system whereby people could submit complaints to the Attorney General. The Attorney General would be required to investigate those complaints, and then would also be able to take civil action against or against agencies that violate the law. So where are we in terms of things in Albany? So we started this campaign in earnest in 2020. We're going into year 3 of the campaign, and we've been slowly building, or not slowly, but gradually and steadily building momentum since then. So we have growing support in both the Assembly and the Senate. We have 44 co-sponsors in the Assembly, and we've also made it out of the Codes Committee in the Assembly and out of the Ways and Means Committee and into the Rules Committee. We've gotten about as far as you can get in the Assembly without actually getting a floor vote. In the Senate, we also have a good number of co-sponsors. We're at 22, but the bill is still in the Codes Committee, and we're trying to really push it and work it out now, work it out of there. We also have a new governor, as Emma was explaining earlier. That is a bit of a wild card. We still don't know how Governor Hochul might react to this bill or how we might be able to work with her, but that is a new factor that we're dealing with. And then we have growing awareness and engagement from across the state, and we are constantly growing the coalition. So I know that we are short on time, so I want to wrap up there. But I did drop the link for volunteer signups in the chat, and I will also drop my own email in the chat for anyone who might want to reach out with questions after the webinar. Thank you.
Thank you so much, Zach. I appreciate it. And we have one more guest speaker, just pulling up the agenda. Nicole Kata, Director of Immigrant Rights Policy at the New York Immigration Coalition, who's going to be speaking to the Access to Representation Act. Nicole, I just want to mention that we have a request from the interpreters to just slow down a little bit so they can catch everything. And are you ready, Nicole?
Yes, thank you, Sarah Beth.
Okay, I'm going to do a screen share for you as well, okay?
Perfect, thank you.
All set? Can you see that?
We can't see it. It says you're sharing your screen, but it's just black.
Okay, let me try one more time.
Still not working.
No. Nothing yet?
Nope.
I'm not sure. Nicole, do you have it open?
I do, yeah.
Okay, I'm so sorry, Nicole. Would you mind sharing?
No problem. I can actually do it without the screen share, so I'll just go ahead and I'll speak slowly. But thanks so much for being here, everyone. I'll just cut right to the chase and talk to you about the Access to Representation Act, which was introduced on January 15th, 2020 by State Senator Brad Hoylman and State Assembly Member Catalina Cruz to create a right to counsel under New York state law for immigrants in removal proceedings, in immigration proceedings. And so the law would require New York to provide a lawyer for anyone facing deportation in New York State and to fund that legal representation year to year. As you may know, unlike in criminal court, there is no right to a lawyer in immigration proceedings, which means that the federal government will not provide you with an immigration lawyer if you are detained or facing deportation. That means if the federal government places you in proceedings, and you cannot afford an attorney, and the nonprofits in your area are at capacity and cannot take your case, you will have to represent yourself in immigration court, even while the government is represented by a trained lawyer. And the statistics speak for themselves. So we see that 78% of people who are not in detention and 32% of people who are detained win their cases with a lawyer, compared to 15% and 4% respectively without an attorney. And so we know that there are too many unjust deportation orders under these circumstances. And this for us is really a matter of due process. We found that this point resonates even in more traditionally skeptical, conservative, and even anti-immigrant areas and contexts, that this is a matter of fairness and due process and just justice system. Of course, most of us on this call know that simply providing legal representation within an unfair system doesn't make that system fairer or more just, but this legislation would at least give everyone a fighting chance in the system that we currently have. And the NYIC has been fighting so hard for a right to counsel in immigration court because we know the needs that our communities face. Again, the numbers help tell much of the story. ICE arrests and deportations in New York have surpassed national averages. We know that we saw a 35% jump in arrests from 2017 to 2018, compared to 11% nationally. And a 29% increase in deportations compared to 13% nationally. And given this huge increase in ICE arrests in the state that we began to see a few years ago, many folks continue to feel the repercussions today, including through ongoing removal proceedings. And indeed, immigration court backlogs have ballooned. Immigration court backlogs have grown from 47,000 in 2012 to over 130,000 today in New York alone. From 2018 to 2019, deportation orders increased by 80%. And moreover, the uncertainty around funding renewals at the state level for legal services and the fact that that funding is not, we haven't seen it increasing, has made it hard for organizations to hire and retain staff and to guarantee clients that they will have lawyers for the duration of their cases. So what this all means is that fewer and fewer people are getting the legal representation and the services that they need. And so for these reasons and more at the NYIC, we're demanding that the state recognize the need for a right to counsel that exists in our communities. And so just a little bit briefly about the history of a right to counsel. There have been attempts to introduce such a bill in the past, but it had never been discussed as a true possibility until almost 2 years ago now, when New York was the first state in the country to introduce such a bill at the state level. And so it's the first legislation of its kind in the country, meaning that New York State has the opportunity to be on the cutting edge of creating a right to counsel in immigration proceedings. This bill has the support of the American Bar Association, the New York State Bar Association, and others. And I can go on and move on a little bit to talk about what is in the bill. In a nutshell, the bill would provide a lawyer for everyone in New York facing immigration proceedings and who cannot afford a lawyer. So everyone facing deportation in New York who makes no less than 200% of the federal poverty guidelines will be given a lawyer regardless of the merits of the case. And for the purposes of this bill, facing deportation has been broadly defined to include credible fear interviews, going through a removal hearing, or having a prior deportation order where there is a basis to appeal or move to reopen a case. In addition to folks in New York, it would also include some people who are detained in New Jersey as well, if they have a connection to New York. The right to counsel would be administered through the Office for New Americans, and that's important because it would avoid competing with other mandated representation initiatives, and the office would have a lot of leeway in how to implement the bill, including creating panels for private bar attorneys, seeking private funding, and expanding the right to people who were not in New York when they were ordered removed, again, as long as they have a connection to New York now.
Nicole, I'm so sorry. Can you please slow down just a little bit for our interpreters?
Sure, no problem.
Um,
Mhm. And because it looks like we're short on time, and I know that folks are eager to ask questions, I'll just skip ahead to what you can do in the upcoming legislative session. We definitely recommend that you contact your state senator and your state assembly member. Ask them whether they co-sponsor the Access to Representation Act and tell them why it matters to you. Really use your personal story, just like other panelists before me have advised. And of course, follow the NYIC to stay up to date on upcoming lobbying visits, days of action, and other ways to get involved. As we gear up for the beginning of the upcoming state legislative session, you'll want to stay tuned to hear about any events that we may have in store to galvanize support for a right to counsel in immigration proceedings in New York State. And I'll go ahead and drop our info in the chat so that you can stay tuned. Thanks.
Thank you so much to all of our panelists for joining us. I know folks probably have questions. We are running a little bit behind schedule. We really packed a lot of information into this panel. I do want to suggest that maybe what we can do is have folks stay on if you are able to engage in a little bit more of a discussion for a few minutes. I don't want to keep our panelists too late. But before we do that, I just want to take a moment to thank some of our the foundations and donors that have been supporting our advocacy work and are really critical to the systems change work that we are continuing to do in the year ahead. So I wanted to thank some of our foundation funders, the Novo Foundation, Jesse Smith Noyes Foundation, the New York Immigration Coalition, the Elias Foundation, Unbound, Philanthropy, sorry, I'm speaking too fast again, and our partners at the Fund Excluded Workers Coalition, as well as some of our major donors, particularly Paul Mersfelder and Lee Dodson, as well as Susan Manuel. We have many, many donors, I think, on this webinar. And if you're not already a donor, we certainly invite you to become one. And Sara has just dropped our link in the chat if you'd like to go ahead and make a donation today or at any point in the future. But I do want to, I guess, turn it back over to everyone here. You're welcome to put your questions in the chat and we can read them out or raise your hand. I think what makes sense to do is take a few comments and questions and then ask our panelists to respond. And so I'll give it a minute. You can either raise your hand or put something in the chat. If you're not sure how to do either of those, just speak up. So one question here from Erica is, I would love to hear more about how your organizations are working together to support each other's initiatives. Great question. Let's see if I can take a couple more questions in here. Yes, Jeff, I see your comment. We will certainly provide all the participants here today with a list of everyone, of all the organizations that participated. All right, I guess we can start with the one question that we do have. Any other questions, please feel free to chime in. Who wants to tackle that one first? How we're working together? I know that we all see a lot of each other, many of us, so.
Emma.
Sí, adelante.
Bueno, quería agradecerles por tan importante información. Sería interesante que se pudiera proveer las direcciones, teléfonos de todas estas leyes que ya están vigentes y que obviamente desconocen mucha gente. Hay muchos inmigrantes que ni siquiera conocen y pues es muy importante esta difusión y pues agradecerles por este gran trabajo.
Gracias, gracias Julia, y por supuesto estaremos en contacto, y también si nos siguen en los medios sociales, ahí van a encontrar mucha información al respecto.
Gracias.
Ursula, you want to go ahead?
Sure. I wanted to try to answer Erica's question, and it's not always easy to find ways to work together because we're so focused on the specific issues we're working on. One example, last year during the legislative session was in, I can't remember which month it happened, but an informal coalition came together called Compassionate New York. And we were making the case that more compassionate policies weren't just the right thing to do, that they were actually going to be good for the bottom line in terms of the New York State budget. And so, for example, we did an action in May with New York Immigration Coalition. It was downstate. I think it was at Speaker Heastie's office that brought together many of the bills that were not getting motion. We're not seeing motion in the legislature. So the New York Health Act and New York for All were part of that, one of the collective actions we did together in the spring. And at this time, Campaign for New York Health is talking with the health policy team at New York Immigration Coalition, how we can be more collaborative on the New York Health Act and the Coverage for All bill, for example. So it's not easy, but even though we work on specific bills, we know that in our hearts, we want to see like all of the big changes happen. So we're all, I think at the Campaign for New York Health, we're always open to ideas for collaboration.
I could also just say briefly. So yeah, we, as Emma said, we see each other quite a bit. We, show up to each other's rallies. We, show up to each other's lobby days. We work in coalition with one another. I am not necessarily involved in every one of the campaigns that was presented on tonight. But generally speaking, we when we do support each other's campaigns, those are some ways we do it. I did also want to mention something called the Justice Roadmap while we're talking about coalitions. I'm going to put the link in the chat. This is a solidarity platform of sorts where that includes a number of criminal legal system and immigration justice bills that are sort of included together and broken out into different categories that, in one way or another, support the cause of decarceration and shrinking the criminal, legal, and immigration systems. And I share it now because I think it's one good example of how a lot of different organizations from a lot of different backgrounds come together to support each other on a wide range of legislation and campaigns. So just wanted to share that.
I think also, I'll just first of all want to reiterate, I'm sorry, I want to especially thank our two interpreters tonight for your hard work. I know we made it a challenge for you with our enthusiastic speed talk, but we really appreciate you helping us make this an accessible event for everyone in our community. I also, kind of will reinforce what's already been said. The way a lot of this work happens is that we work in coalition, and we often have to, as organizations, prioritize which are the issues that are most urgent and relevant for the communities that we represent or that we serve. And so we often have to make difficult choices about what issues we are prioritizing, but we always try to remain cognizant of the other fights that are interconnected with our own and build those bridges where we can. So we might choose 1 or 2 or 3 priority issues for a given a session or for a given cycle, but it doesn't mean we're not keeping an eye on that broader systemic change that I think many of us are really dedicated to achieving over the long term, and looking for ways to support each other wherever we can. So if you want to see more collaboration, if you want to see more work together, I think we all are, very much inviting more participation from, especially a lot of campaigns are very heavily well represented by organizations based in New York City. Obviously, that's a big population in New York City. There's a lot of political power, there's a lot of economic power, but we need more people in our upstate communities engaged in legislative advocacy, engaged in policy work, and engaged in the political process, right? In order for our issues and our voices to be heard. And this is a big, I think, through line in all of the campaigns that we as Worker Justice Center are involved in, and I think is probably true for others on this call as well. I don't see many more questions in the chat. I know people have had to drop off. We will be following up with more information. Are any business organizations providing support? That's a great question. And the responses may vary. I'd be curious. So we'll take this as the last question and then we will sign off. And again, as I was saying, we will follow up with an email where you can get in touch with our panelists and engage with the campaigns. Thank you all so much for joining us. So we'll wrap up with this last question. Anyone who'd like to can respond.
Emma, can you repeat the question?
Are any business organizations providing support?
I can share. So we work a lot with restaurants. What's the question? Are any business organizations providing support? Yeah. So the National Restaurant Association is the industry lobby that lobbies against raising the wage of tip service workers, but several small employers and independent restaurants do actually support us. And we have a High Roads restaurant program where employers pay the full 15 and also commit to gender and racial equity and run a profitable business. So we have about more than 2,000 of such restaurants across the country, and several others who've been recently documented in a New York Times report, which I'm going to drop in the chat. So, just to puncture the narrative that this is bad for business, it will kill jobs. It's super powerful to have an employer persuade a legislator that, no, actually, I can do this. And to support me, you need to pass statewide policy because it'll actually help me be able to maintain this.
That's a great response. Any of our other panelists want to chime in on this?
We don't have, it's on our to-do list, is to do that outreach and get more support for the New York for All campaign for businesses. We certainly think it's something that there's reason why private businesses would want to support it.
On the campaign for New York Health, we have a business for New York Health piece of the campaign, and over 500 businesses have endorsed the bill, but it hasn't, sometimes the support question, I think we would love to see more support from business and financial support from larger businesses. I want to give a shout out and appreciation to the National Young Farmers Coalition. Erica's on the call, and so we're really grateful, especially for the young farmers and the organic farmers, for supporting the campaign. And it's also a place where we hope to build out support in the coming year.
I think we're all done for the night. Thank you so much, everybody, for staying on a few minutes late with us. Thank you to the interpreters again, all of our panelists. Again, if you'd like to support our work, and increase our ability to do advocacy work at our organization, you can head to www.wjcny.donate. And thank you all so much.